I'm here, Dr. Villa. I just want to make a short reaction to the one of the videos that was posted actually by Nick Halser, my friend Nick Halser. Hi, Nick. If you will happen to, uh, listen to this video of mine. um, I mean, first of all, I'd like to thank you for posting so many critical or vital information on the complication of vaccine.
This study is highly disturbing. They found 100% of COVID-19 vaccinated individuals have these circulating anomalous amyloid microclots in their blood. This is misfolded fibrin that sticks to many biologically active materials circulating in the body, and it conglomerates into these irregular masses that block blood flow and cause all sorts of horrible issues. It's the exact same pathology that has been identified as being behind the long white fibrous clots being pulled out of corpses worldwide. Majority of embalmers now across the globe do now pull these white fibrous clots out of corpses, and this is what's behind them. So if it's in 100% of the vaccinated population, we are running into a serious issue here. This needs to be investigated immediately by the CDC, do their job for a change, and investigate what is happening to the population. And even those who were unvaccinated, there was only about 4 of them, but it appears they also did have these circulating amyloid fibrils in their blood. And so we don't know how many people these are inside of, but based on this sample, which they didn't know they would have these clots, but when they looked, it was in all of them. This is very serious. These have to be pulled off of the market immediately.
But this video, what's very interesting is discussing about the presence of amyloid, the beta amyloid. And I actually started testing this beta amyloid like late last year. So probably I have, more or less 250, 300 cases or patient tested for the amyloid. And what's very important, I just want to emphasize that remember at least in the vaccinated individuals, you can see so many reports of, the white clot. We call them calamari clots, right? And they are like gummies because when you take them out, they're kind of, you can stretch them. And yeah, that's called calamari clot. And the initial reports on that um, uh, were actually done by the embalmers or the mortician because they're trying to do the process that they have to do the embalming, and then they notice that the blood is not coming out, and so they have to do a little bit more examination, and they they found out accidentally that the blood vessel, usually the arteries, but it can also happen in the veins. Okay, any blood vessel in the body, but uh, they were able to find all these long white clots, coming out of the carotid, in the on the limbs and on the lower extremities. They're really kind of long. And so that was in the beginning, and actually it's coming back again because more and more morticians are reporting them. And in the beginning also, it was happening right after the inoculation or right after the injection. So basically, what is this made of? Is it made of the amyloid? It's called beta amyloid. And there are two types of amyloid, of beta amyloid in the body. You have the beta amyloid 40 and the beta amyloid 42. And the amyloid that is involved in this white clot is actually the amyloid 40. So this is also the same amyloid that the Alzheimer patient are producing. So if you look at the brain of the Alzheimer person that's advanced, the PET scan or the amyloid scan, you're going to see it being deposited in the brain. It's exactly the same amyloid. It's called amyloid beta amyloid 40. There's another amyloid which is called amyloid 42, and that one is supposed to be the good one. And so when we order the test, amyloid 42/40 ratio, it cannot go below 0.17, or a good one should be higher than 0.17, 42/40. So when the ratio is low, that means you are um, producing more beta amyloid. That's bad. Now, that's one component of the white clot, the calamari clot. And what are the two other components? The other one is the spike protein, and the third one is the fibrin or fibrinogen. You have to measure the fibrinogen, and then it gets converted into fibrin monomer. And usually the conversion will happen if you have a lot of inflammation in the body, if you have a lot of inflammation in the cardiovascular system. And so if you have a lot of that, and then you can have potentially form the white clot. The regular blood clot is easier to actually deal with, but the spike protein is always involved in this clot formation. And there are several mechanisms. But it's very interesting that Nick posted that, and so it's very important because I see two things that I identify with the 300 plus cases that I've tested. Not is a big percentage that they don't have history of Alzheimer. They don't even have family history of Alzheimer. And I'm testing everybody here in my practice because I have the senior population. And that's the number one problem is actually the cognitive decline. And since the injection rollout, the COVID vaccine rollout, one of the major things that I see in this senior population is actually the memory issue or the cognitive decline. When they start behaving that way, we need to look at the Alzheimer. And even if I don't give them the diagnosis of Alzheimer, it's a cognitive decline, but they're behaving like, so I call it Alzheimer's like, because it's like, to me, it's a new disease. They don't have any family history. The patient was, functioning so well before the injection. And then suddenly now, not usually, but it started becoming more obvious was on the fourth year, and definitely in the fifth year. So I just want to mention that as a reaction. If I have more information, in the future, I'll bring it to you. And I think I'm going to do an analysis once I have to go back to my database, to the records, and then see exactly and analyze it. How many have low, what do you call this, beta amyloid 42/40 ratio, which is, if you have low ratio, then you have two risk factors. You're at risk for clot formation, and you're at risk for having a dementia or Alzheimer-like type of dementia if you are, even if you don't have, family history of that. So I think it's one thing that we need to keep to look at, because I'm going to tell you this is another problem, because if the booster of the injection can precipitate that, unfortunately, and this is just my observation, it's early to say that that's what it is. The infection serves like a booster, and it will create the same thing, which makes sense because the common, I think in my previous recording, the common denominator of infection and injection is really the spike protein. I cannot overemphasize it, that the spike protein is one, or is the major disease causing entity of this whole saga of COVID. Okay? It's the disease, if not the only one, it's the number one, and it is the most significant disease causing entity of this whole saga of COVID. So I think that's it for now. And yeah, thank you so much for listening. I hope you learned something, but I'll discuss some more about that as I get more data, as I gather more information. Okay, thank you so much, and have a nice day.